Hey everyone, thank you so much for joining episode 13 of The Green Life. What 2 weeks we had. Last week we had here Dr. T. Colin Campbell on the show, and this week another veteran in health, Dr. Caldwell Esselstyn. Dr. Esselstyn received his BA from Yale University and his MD from Western Reserve University. In 1956, he also received a gold star as part of the US rowing team at the Olympic Games, and that is quite an achievement. He was trained as a surgeon at the Cleveland Clinic and at St. George's Hospital in London. In 1968, as an Army surgeon in Vietnam, was awarded a Bronze Star. So when I say that he was a veteran, I actually really mean it literally here. His CV is packed, full of experiences, contributions, awards, so he really knows what he's talking about. In 1995, he published his benchmark long-term nutritional research, Stopping and Reversing Heart Disease in Severely Ill Patients. The same study was updated at 12 years and then again renewed beyond 20 years for its last book, Prevent and Reverse Heart Disease, making it one of the longest studies of this kind. That is quite an achievement that we can look at, because this is not just a doctor saying that he cured people, this is a doctor showing that he did. His programs are still going on, accessible online at the moment, where you can sign up and learn everything he has to share about how to reverse and keep heart disease away. This is such an asset for us all, because this disease is rippling our entire community, and we therefore want to get healthy, and this is a way to do it. So without further ado, welcome Dr. Esselstyn. Hello, Dr. Esselstyn. Thank you for joining us on the Green Life podcast today. What an honor to have you here. How are you?
Thank you, Chantal. I'm delighted to be with you.
Me too. We had a bit of a rocky start with technology, but I'm happy we managed now. It's so wonderful that you had the patience. Thank you so much. I really appreciate it. So a lot of people know you for your wonderful work in cardiovascular health, but let's just give them a little introduction to you. And I'd like you also to talk about your achievement as a gold medalist, because that is something that cannot go unnoticed. So give us a little background of where you come from and how you became a doctor.
I'm sorry, how did I become a doctor?
Yeah, why you became a doctor, how you got onto this path.
Well, my father was a physician, but I wasn't really quite sure that I wanted to go into medicine until about my second or third year on working road construction. I was offered the job of being the foreman on the road construction job. And I thought to myself, no, I really think that my first choice would be medicine. And why don't I do this? I'll try to see if I can get into medical school. If I can't, I can always fall back into road construction. but if I get into medical school, maybe that'll tear it. So that's not very glamorous, I'm afraid. But it was. I was very curious also, especially during my time when I was rowing, that I got very interested in how the human body works, how it responds, and so forth. So that was the background.
Amazing. And I guess actually touching on that point, I guess you saw performance athletes really being fit and performing really well, obviously on the Olympic team. And then did you notice what the push for nutrition was at the time? Did you ever go back and think, actually, we were told to eat in a certain way that is obviously probably more aligned to a Western or American diet than a obviously plant-based diet? Did you ever think about it and go back into that kind of connection?
Well, I think at that point, all athletes were eating in a way that today would be looked on askance with great concern, because the diet that is so heavy in cheese and eggs and meat is hardly a diet that an athlete would eat today.
Yeah, so very high in animal protein, really.
Right.
Yeah, and it's fascinating how this has changed. I think obviously the more people are more aware of how they should eat for performance, but also for health, and that the protein myth about having this complete protein from animals has been a little bit demystified with information, and people like yourself and also
Well,
your
I think, yeah,
son, really.
no, I think that's pretty well passé now. Everybody, the athletes, even most professional athletes, are turning to plant-based. Why? Because they have greater stamina and quicker recovery time.
Yeah, absolutely. It's true. I myself find that my recovery time when I exercise is way better, and I used to be sore for days after a workout. So now that's not happening anymore. So I'm happy that I can vouch for that, and I'm not even performing as like an athlete. What did you ever notice? What happened to athletes when they stopped, however, competing? Because I guess they were really healthy and fit while they were performing at the time. But then what happened after?
No, some athletes will continue recognizing and using a more modest approach can reasonably maintain their level of fitness and health, but all too many let it go completely, and then they begin to gain weight. They become hypertensive. Some of them get diabetes. It's not a very pretty picture.
Yeah, absolutely. No, it's not. So, okay, well, that was great. I wanted to touch on that because I want to get into a place where we can discuss how people, even when we're younger, we obviously think we're invincible and we can eat in many ways and get away with it. But later in life, we kind of pay the consequences. So the bill comes for not treating our body right. And then here we have diabetes and cardiovascular disease. And obviously, your specialty is cardiovascular health. What I'm interested in is kind of looking at where do you think it starts, so where we really need to go back into, looking at our diets. From which age? Does it start in childhood? Does it start later in our teenage years, young adulthood? Where do you think we really need to start paying attention?
Well, we have 4 children and we have 10 grandchildren.
Congrats.
They are all 100% plant-based,
Amazing.
whole food plant-based nutrition since they were in childhood. Yeah.
And you see them being
Well, that's
absolutely
not quite true with all of ours because our children were about late teenage when we decided to make the transition. When to me it became so apparent that the reason that there were multiple cultures on the planet Earth who back 100 years ago and even today are really cardiovascular disease is virtually non-existent in those cultures. And the common denominator is they're consuming whole food plant-based nutrition. Now, as far as what many people, of course, don't recognize that, well, let's just cite a study that I like to quote about the pathobiologic determinants of atherosclerosis in the young. This was a study in 1999 looking at young women and young men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. And at autopsy, early coronary artery disease is ubiquitous. Everybody. Not enough for their cardiac events yet. They don't feel anything yet. But they keep eating the same way. And now, by beginning in our late 40s, in this country, we now begin to see this tsunami of cardiovascular disease because of the fact that we've started creating this disease even in childhood. Now, you might say, well, what is the area where all experts would agree where this disease has its inception, its onset, its beginning? And that occurs when we progressively injure the life jacket and the guardian of our blood vessels, which happens to be that delicate innermost lining called the endothelium. And it is the endothelium that manufactures a truly magic molecule of gas called nitric oxide. And it is nitric oxide that is responsible for the salvation, preservation, and protection of all our blood vessels because of the remarkable functions that nitric oxide has. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, Nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number 3, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, protect us from getting high blood pressure, hypertension. Number 4 is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaques. So literally, everybody on the planet Earth, whether they're from London, Berlin, Chicago, New York, or Barcelona, if they have cardiovascular disease, it is because by now, in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck. If they no longer have enough nitric oxide to protect themselves from making blockages and plaque. But the good news is this. This is not a malignancy. This is a completely benign foodborne illness. Yeah. And once you can get patients to understand that never, never, ever again are they to pass through their lips a single morsel that is going to further destroy their endothelial production of nitric oxide, because then the endothelial production of nitric oxide recovers, and we make enough nitric oxide so we can halt disease progression. And often we see striking examples of disease reversal.
So if somebody were not quite informed about, what nitric oxide is and how it really works, what kind of food, they would ask, what kind of food really impairs it, what kind of food damages it? And if we had to give them a list, because saying, animal products is very broad, but they might not, if people are not educated, they might not know what that even means.
Well, let's talk about what are the foods that destroy and injure your endothelium.
Yeah.
Number 1, any drop of oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a chip, oil in a piece of bread, oil in a salad dressing. Oil is a killer. Oil will injure your endothelial cells, as does anything with a mother or a face. Meat, fish, chicken, fowl, turkey, and eggs. Also, anything that is dairy, milk, cream, butter, cheese, ice cream, and yogurt. Also, we want to avoid sugary drinks, Diet Coke, Pepsi, and Coke. We want to eliminate sugary foods such as cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. Okay. And I don't like peanuts, peanut butter, nut butters, cashew sauce, avocado. And lastly, coffee with caffeine. Decaf, yes, but coffee with caffeine injures endothelial cells.
That's so interesting, because I was listening to a podcast by Simon Hale, and they were talking about how some research shows that caffeine is very good for cardiovascular health. And it's a paradox that, I heard before that it's not, but then, they were talking about how this research shows that it is. And so it's, why do you think that we have such conflicting information even in the science?
I don't think they know the science, because I'm talking now about 2 studies, one Greek, one Italian. In the Italian study, they took healthy young subjects, divided them in 2. Half drank the coffee with caffeine. The other drank the coffee that was decaf. After they drank it, they did the brachial artery tourniquet test, which measures the diameter of your brachial artery at your elbow. And then they switched groups. The group that previously was having decaf was now having coffee with caffeine. It was always the group drinking coffee with caffeine that in this study compromised the production of their endothelial cell, nitric oxide.
Wow. Okay.
And you know what you have to do? There are so many studies out there to make sense of it. See if they've done this. See if they have taken a group of patients who are seriously ill with cardiovascular disease and see if their disease, see if their program is halting and arresting and reversing their disease. That's why we will actually we'll put our program against any other planet on the Earth, because the reason that we have success where others fail is because nobody else is as mean as I am.
You're not mean.
Because I hate failure in my patients. I want them to understand all the details so that we can absolutely stop their disease. Because this is think about it. What an embarrassment it is for the United States and Europe, the way that we've treated heart disease. We have known, all those doctors in Europe, all the doctors in the US have known that heart disease in rural Okinawa, rural China, Central Africa, the Papua Highlands, the Tarahumara Indians in northern Mexico, no heart disease. Why? Because they're all getting stents and bypasses and drugs? No, because that way they eat. It is so embarrassing that in Europe and in this country, what do we treat with? We give people pills that have nothing to do with the causation of their illness, or we give them stents or bypasses, none of which have anything to do with the causation of the illness.
This is sadly a broad approach of the medical industry.
Why do you think that is? Why do you think that is?
Well, first of all, there's financial interest by the pharmaceutical companies.
Yeah, it's money. It's money.
So
I remember asking a cardiologist once, several years ago, I said, why are you reticent to send me some patients where we can actually end their disease with nutrition? He said, simple. Do you know what my bill charges were last year? I said, no. He said, over $5 million.
Wow.
So, pretty temptation.
Yeah, it's sad that sadly, and I guess this trickles down to the education system, because when people study medicine to become doctors, their knowledge on nutrition is non-existent. They don't really learn anything about nutrition. And if they did, what they do is very basic, and it doesn't highlight the importance of a plant-based diet. They always focus on the very traditional approach, which is protein, carbohydrates, and fats, and what they do, how many calories they have, and what if you have to tweak a little bit your diet if you have, diabetes or heart disease, but in a way that really doesn't give any relief. For example, people that have heart disease might have high blood pressure, so the doctor would be like, just lower your sodium, and that's it. And they go home with nothing but this information, and then they start buying low sodium salt, and that's it. That's all they change, right? I've seen this many times.
Well, we've talked about the foods that injure the endothelium. We ought to talk about what are the foods that we want people to eat.
Yeah, let's talk about solution.
All these marvelous whole grains, whether that's brown rice, bulgur wheat, barley, rye, it may be buckwheat, farro, quinoa, and eat the whole grains, or as a cereal, bread, pasta, rolls, and bagels, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. And none of those foods are going to injure your endothelial cells. Yeah.
No, absolutely. And they're amazing once you know how to, prepare them and eat them. I must say, I only stopped eating oil last August. And I've noticed, because my background is Italian, that I had an attachment to olive oil, it was emotional. I saw my grandmother cooking with it.
But Italy isn't the only country, and there's Spain
and Portugal, where I am, same. I mean, they bathe their food in olive oil. But what I'm saying is my emotional attachment to it.
So they soak the bread in it.
Yes, not just that. I remember my.
There is heart disease in Spain. There is heart disease in Portugal.
Plenty, and this is why sometimes when we talk about the Mediterranean diet and how healthy it is, it confuses me, because I don't understand what demographic are we looking at, because I still have family in Italy, and they all have heart disease, all of them. and they eat a traditional Italian diet.
You have to tell them the oil is a killer. I wrote an editorial in 2019 in the International Journal of Disease Reversal and Prevention. The title of it was, "Is Oil Healthy?" And I reviewed the animal studies and the human studies showing how oil injures the endothelial cells.
So can I ask you why some cardiovascular doctors, some that you actually know and have been on panels with, would promote olive oil, and they say, okay, I understand that.
Because they don't know the literature, and they've never, ever, rarely have they treated their patients with whole food plant-based nutrition. It's not common to find a physician who is treating their patients with whole food plant-based nutrition because several reasons. One, they say the patients won't follow the diet, right? And two, if you're going to ever have a patient make a successful lifestyle change, that is not going to work if you give them 10 or 15 minutes in the office without the spouse or the partner. Doesn't work. But if you show the patient respect, by that I mean give them time. Give them time. And by that I mean, right now, for example, our program, I counsel usually no more than 18 or 20 patients on a single day, and it's our intensive seminar, 5.5 hours. But before then, 10 days before then, my secretary will give me the phone numbers of all the patients who are coming, and I personally call each one of them individually so that I can get my arms around their story, and at the same time provide them with an opportunity to ask questions of me. That way, we're running about 89.3, almost 90% adherence. And that's the whole key if you're going to be successful in this. And then in the 5.5 hours and during the phone call, I explained to them the science that I've just shared with you briefly with your audience here, namely that the only reason they have cardiovascular disease is because they have progressively destroyed and injured their endothelial production of nitric oxide.
Yeah, it's really, it sounds very simple in a way. And maybe that's why we tend to overcomplicate, and people are like, no, doesn't make sense. It does make sense.
It is simple and it works.
Yeah, absolutely. So if somebody now comes to you and they have heart disease, which is most of your patients, clearly, what is the best food? Now, we talked about the food that doesn't hinder the endothelial, but what is the one that really can work magic on a damaged cardiovascular system?
Well, I don't think it's so much a food that you eat that does that as it is the foods that you avoid, because nature in your body has created this wonderful lining, this endothelial lining, and there's not, but there are, the foods that really I would have to put at the top of the list would be the green leafy vegetables, because that's that's really sort of been discovered within the last 20 years or so, that when you are eating green leafy vegetables, there are several ways that we like to enhance the production of nitric oxide. Do you want me to go into that detail?
Yes, please. I would love that. Yes.
Well, for instance, about a decade ago, I modified and changed our program because of two things. One, we learned that the endothelial production of nitric oxide is age dependent. You never heard of a boy or girl at age 8 having a heart attack, right? No, they have nitric oxide coming out of their ears.
Yeah.
By the time they're age 50, beautifully healthy, they now have 50% of the nitric oxide they had when they were age 25. By the time you're 80, you've lost 70%. So here's what we do. The second thing that was important a decade ago was to adapt the knowledge that there is an alternate pathway by which mankind can make additional nitric oxide. So here we go. I need them to chew a green leafy vegetable 6 times a day that is roughly the size of half of your fist after it has first been steamed in water 5.5 to 6 minutes, so it's now nice and tender, then you must anoint it with several drops of a delightful balsamic or rice vinegar. Why? Because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon, 4, dinner time, 5, and of course I adore it when you have that evening snack of arugula or kale. Now, the second benefit from chewing the green leafy vegetable, it restores the capacity of your bone marrow to make the endothelial progenitor cell. What do? The endothelial progenitor cells can restore your bone marrow's capacity to replace our senescent, injured, worn out endothelial cells. Now, the third and most important benefit from chewing the green leafy vegetable, when you are chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is now going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to mix with and reduce the nitrate to a nitrite. Once you swallow the nitrite, it is now your own gastric acid that is going to further reduce the nitrite to more nitric oxide. So think about it. What you're doing, literally, with minimal expense, no hideous side effects, all day long, from dawn to dusk, morning to night, you are absolutely restoring. You are restoring nitric oxide, the very molecule, the deficiency of which has given you this disease in the first place. Now, there are some caveats to this. Toothpaste with fluoride, public drinking water with fluoride, or mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids, because antacids will reduce your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide. Now, the top 6 would be kale, Swiss chard, spinach, arugula, beet greens, and beets. Now, if you want the whole list, it is bok choy, Swiss chard, kale, collard green, beet greens, mustard green, turnip greens, napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and root. The only reason I do that is to show you how it is that whole food, plant-based nutrition helps your memory.
Absolutely. We should put this on auto, on like on a music, on a CD. So it's such a nice beat. Well done. That's amazing. I can't even say that. I'm going to work on that. That's beautiful. So can I ask you why does apple cider vinegar, like raw apple cider vinegar, would have the same effect at all as a balsamic vinegar and a rice vinegar, or they have different compounds?
The only reason I stick with rice vinegar and balsamic, that is where the research was done.
Okay.
Whether the others work, I do not know. I have not seen the research.
Okay. You know what's interesting about the decrease of certain elements in our body as we age, and how many studies show that even hydrochloric acid in our digestive system decreases as we get older. So our amount of protein, for example, especially when people eat animal protein, is so not beneficial for us as we age. And when I say age, is anything after 25. So it's quite amazing that these are not put together, even at the basics, even if you're not a cardiovascular disease expert, or you're not a doctor that is, you could be a GP, like a family doctor. Even that kind of information should just trigger that questioning: are we meant to eat animal products at all? And especially after a certain age. And I feel that this is really interesting, because now we see a lot of people that are put on, anti-acidic drugs, like you just said, not to have that if you want your health to improve. But it's amazing how they put them on these drugs, because they say that they have more acid in their stomach, but in fact they have less. And so this is why people have actually more acid reflux. It's because they don't have enough hydrochloric acid to digest certain things, namely animal products. So it's fascinating to me that we are at that stage where we have all this research and we still don't connect the dots. It should be really a flag to say maybe our approach to health needs to change and plants are the way,
No question.
Thank you. A man of few words. So can you tell me a little bit more about your program if somebody wanted to do it, especially what's happening now with COVID? Obviously, everything was stand still. Did you resume in person or are you still doing online courses?
Well, I used to do it in person, but now since we've been with the pandemic, everything is done virtual. But we have many patients from overseas. They simply call my secretary. They indicate that they want to sign up on the program, and we do it virtually, Zoom, because we treat patients in the United States, Mexico, Canada, overseas. But it's exactly what I just went through with you earlier. These patients are going to learn all about how they have created their disease and precisely how we are going to empower them as the locus of control to halt and reverse their disease.
Yeah, that's perfect. So you don't have to, anybody can just reach out and basically sign up. Is that what you're saying? Anytime.
Yeah, I don't think, the one person we probably wouldn't be able to help would be somebody who's a smoker, because if they're going to smoke, our program doesn't work. Nobody's program works. But if they've stopped smoking beforehand and they're willing to come on board, that works fine.
Actually, it's right. Like when you were talking about the bacteria in our mouth, I read a paper about the importance of our microbiome in our mouth, because we're always talking about microbiome in our gut, but in the mouth is just as important, which is where our digestion starts. And you're right. There's this correlation between smoking and killing the healthy bacteria in our mouth. And many doctors don't talk about it either. So never mind the other effects on the cardiovascular health that the cigarettes have. But this is really important. And you're right, it wouldn't work if they smoke, because they're starting with killing the very elements of life that would, reverse their heart disease in their mouth, right?
Right.
Can we just go quickly to inflammation? A lot of people use this word all the time. We talk about anti-inflammatory diets or inflammation, and a lot of people don't even know what that means. If you had to explain it in layman terms, how would you explain inflammation?
Well, the best way to make people grasp and understand it is if they've ever had a cut on their finger. A cut on their finger, that initiates, and you can see it with your finger, that it initiates immediately this enormous influx of highly specialized immune cells that rush to this area because of the signal that the skin has been violated, it's been cut. And so you find that even no matter how careful you are, there'll be some swelling with the finger. Now, if it happens to get infected, the army of cells that is trying to protect you is even more ferocious, and you'll notice all this swelling. But as nature begins to get on top of this, guess what happens to the swelling? It begins to recede and go away. Now, whether that happens in your finger from a cut, whether it happens from an abscessed tooth, whether it happens from a bladder infection or an infection of your toe with athlete's foot, or it could be infection of gallstones. In other words, there's this sort of general, and it could be the inflammation may come from the inside of your arteries with their disease, with all the inflammation that goes with the laying down of blockages and plaque. So it's really almost pretty universal, and so many other conditions that we have, even like Crohn's disease, ulcerative colitis, rheumatoid arthritis. Yeah, not good. But inflammation is essential to help us try to cure these things, especially if you address the causation. And that's my whole criticism of the cardiovascular profession today is that they do not treat the causation of the illness. Mm. And I wrote a paper in 2014 that was published in the Journal of Family Practice, and that was 198 patients who had been involved in our study, and we followed them close to 4 years. And it was interesting that 89.3% followed the program as it should be, and there were 21 out of the 198 that did not. The ones that followed the program, there was no heart attack, stroke, or death. There was one patient in the program who totally misbehaved when he was in China, ate all the wrong foods, had a small stroke from which he recovered. But the 21 patients who didn't follow the program, 62% in that close to 4-year follow-up period had a cardiac event. So it was really quite exciting for us to be able to prove, because even when you think about it, if that patient hadn't misbehaved in China, our success rate over 4 years, unheard of, would have been 100%. Nobody would have believed us. So that's why I put him in that group.
I see. So that's amazing. So if you had to say that there was one thing that doctors, especially heart doctors, had to learn now, immediately, urgently, what would that be?
Well, they have to learn about nutrition, because the skies have opened up and have given the medical profession the strongest tool they've ever had in their toolbox, which is, we're not talking just about heart disease. If we treat somebody with heart disease who has hypertension, it goes away. Diabetes, it goes away. The risk for vascular dementia goes away. The risk for stroke goes away. The risk for ulcerative colitis, Crohn's disease, rheumatoid arthritis, lupus, multiple sclerosis, allergies, and asthma. When have we ever had anything that powerful before? But the doctors are never taught nutrition in medical school, and none in their postgraduate training either. You just want to feed somebody enough to keep them alive. That's food is it? No. There's much more in food than that. It's where all this illness begins.
Yeah. And I guess the problem is also, talking about inflammation, is that people are chronically inflamed. So the immune system can even use inflammation as a warning sign for repair. It's going to long-term, obviously, create problems if it's always there. It's just like our amount of stress. We have our stress is very important for us to be alert and to get out of situations that are perilous, but then we are constantly under stress, so that now our body doesn't know what to do when things happen, because we are constantly in a state of alert. And I think society doesn't help that. I think we gotten really ourselves in a bit of trouble here, between, obviously there are so many layers as to why this is happening. We have the corruption of the system, policymakers, benefiting from the situation being what it is, pharmaceuticals having too much power, corporate having too much power, and things are just not demonstrated properly. And I've seen, sadly, even science being corrupted, because you can take any angle and make it work for you if you pay for it. I've noticed that when you do science, I think it needs to be real, and you need to accept that sometimes we don't get what we expect out of it, right? The answer might be different to what we expect or want, but be honest about it, and that's not happening all the time. And if you don't mind me segueing into a conversation I was having with Dr. Colin Campbell last week, and you were involved. Basically, we were talking a lot about policy making and a lot about corruption, and we talked about a BBC documentary by Horizon that was made, and he mentioned that the doctor / interviewer from the UK that went to interview him also came to see you and had a meal with you, and that you had testimonies of your patients at that meeting that were not included in the final cut of the documentary. Do you recall that episode?
It's probably there somewhere, but I've had so many episodes that
I hear you. Well, it was called the Dirty Truth of Clean Eating, something like that, by BBC in the US, in the UK. So yeah.
Oh yeah, no,
You,
I remember. Oh my, oh yes, no, that was terrible. No, I had all my patients. Well, I had, when I say all, I mean I had 4 of my patients who came to be interviewed by him, and he was trying to downplay plant-based nutrition. They had all been cured of their disease. They absolutely took into him, and they just absolutely told him the way it was. He was saying, I said, well, isn't it horrible and terrible to eat that way? They said, you're crazy. It's been saving our lives. What are you talking about? I mean, they just laid him out and he was very, very impolite, but they came through.
yeah, I heard that. Yeah, Dr. Campbell
Well,
said.
I apologize that for a moment I wasn't. I was trying to think of when I was in the UK or something, and I couldn't recall that. He was actually here in the States.
He was there. Yeah, he was there. Yeah. I was. So this came to my attention because a couple of months ago, I had COVID, and I was just sick. I mean, like the flu, a little longer. But and while I was in bed resting and recovering, I basically just watched documentaries. And one of the things that I watched was that, and I remember watching it when in 2015, and I it sounded strange. So I really wanted to talk about this to Dr. Campbell, because I was like, it felt like he was not including all your answers and just editing the interview in a way that would suit him. And then he told me about the fact that they came to see you, and they even had a meal with you, and your wife Anne cooked for them and for him, and that he interviewed your patients, and then none of that made it into the documentary. In fact, I didn't even know they came to see you because it's not in there. So it just really, when you start doing research about health and you want to interview amazing speakers, you see all these kind of dots coming together, because I picked up on a lot of agendas being pushed one way or another, and this is why I always say, science needs to be honest, and we have to also. A lot of people want to downplay it by saying it's anecdotal if somebody feels better, but it's not. There's research behind it. There are actual controlled studies, but also anecdotal shouldn't be downplayed, because our experiences as human beings are just as powerful and important if we are changing our lifestyle and making ourselves better. And so I really wanted to look into that. And yeah, so okay, so it's interesting, isn't it, how it all plays out. And I guess people are confused because of this. And if we go back to the initial question, when do we start getting healthier, when should we start and really look after our health, one of the problems is that we've been always taught, if you don't feel wrong, if you don't see it, it's not there. So if you don't feel like you're dying, you're fine. And that's not really it, because our bodies are resilient, but that doesn't mean we're healthy. So in that case, because people need to be having more awareness about the health status, what do you recommend people do in terms of perhaps diagnostics? So checking blood tests and seeing a doctor. What do you think that their approach should be to know they actually are healthy before disease develops?
Well, I think probably the easiest and simplest thing to do would be just get your lipid profile, your cholesterol and its derivatives would be one thing to do. If you're really worried about whether you have heart disease or not, a calcium score, which is simply a CT X-ray of your chest, is available. And that's, you kind of have to ask yourself, what are the tests that every year those who are in rural Okinawa are getting, or in rural China, or in Central Africa? Are they getting their cholesterol drawn No, they never have heart disease, right? And one of the reasons that medicine is so expensive in this country right now, for example, in Medicare, which is the largest government agency for expensing care to its elder citizens, 46% of Medicare is cardiology. And you ask yourself, what is cardiology? It's stents, it's drugs, it's bypass, expensive diagnostic studies, none of which would have to be in evidence. Think of what would happen if the government saved trillions of dollars through these unnecessary tests. Yeah.
Yeah, absolutely. Our research, our money, anything is going the wrong way. And what if they educated people about health? I mean, we've seen this in the pandemic. Not one single government talked about nutrition and exercise. None of them. So it makes you really wonder. And you talked about the blue zone, so Okinawa a few times, and rural China. Does looking at these populations, does it demystify the thought that maybe cardiovascular disease is genetic?
No, I think that the idea that cardiovascular disease is genetic is kind of absurd when you look at what happens to people from those nations where cardiovascular disease is virtually non-existent. What do you think happens to them when they move to this country and they start eating the Western diet?
They get sick.
Bingo. They now have the Western disease. Yeah.
Yeah.
That's true of cancer, and it's true of heart disease.
I guess it makes sense because what we get from our parents, other than genes, it's habits, right? We learn from them how to eat. We learn from them how to cook or not. Many people don't know how to cook, sadly. So it's the habits are more important. Lifestyle is much more important, perhaps, than the genetic profile. And I'm not downplaying the fact that we have predispositions, but epigenetic has shown that even though we have predispositions to something, we can always not switch any of those genes off. And then in some cases, it's not genes at all. It's, as we said, it's lifestyle. Like when you have people that come from places where there is no disease and then they arrive into America or Europe and voila, now they have to rush to the doctor. Are you afraid that because of the way that the world is moving, with the influence of the US, Europe, our culture and our habits are taking over places that before never had access to so much meat and McDonald's? Do you fear that these blue zones will be are getting extincted?
That's a difficult question to answer. It all depends upon how intrusive and how vulnerable they are to their offspring and their relatives who leave the blue zone. And then they decide, and they learn the Western ways. And then they decide to come back and they carry those new dietary problems with them. Then there would be an issue. But actually, as far as plant-based being talked about 34 years ago when I started was very, very rare. And now we have some organizations where there literally are thousands of doctors who are members of the Plant Nutrition Society. There may be 5,000 to 8,000 in the American College of Lifestyle Medicine. So I think it's coming around. Take a while, but it's coming around.
That's very good news. What do you think about diets such as keto, paleo? And I know what you think I know what you think in the start, but
Yeah,
when you have to talk about people saying they work and people are feeling better, what is your thought about that?
I have well, if you you register all the all the problems. But it increases cancer, it increases vascular disease. It's a disaster. Nobody has ever taken a group of patients seriously ill with heart disease and give them a keto diet. There's no long-term study on that. And it's all eating like paleo, like eating meat. And meat immediately opens up a whole Pandora's box of problems.
So yeah. Interesting. I'm asking because obviously there is a big debate on, and I know social media is not always the platform to look for these things, but people look at them. And so, and even when I studied nutrition, I remember some classmates being very much into eating a paleo diet or a keto diet. And to me, it really didn't make sense. And I know now we have vegan keto diets or plant-based keto diets. But we are talking again high fat, and if you understand how the body really works, where our energy comes from, if we are meant to get our energy from glucose, from carbohydrates, why are we shoving so much fat into our body to then transform it into glucose to use it? It's like really not a very smart way.
Have you ever heard of TMAO?
Yeah.
Well, that was work by Stanley Hazen at our clinic, where he took persons who were omnivores, who were eating a whole list of animal foods.
Mm.
And those foods contain the molecules of lecithin and carnitine. And he found out that omnivores, when they eat those foods, they possess in their gut, in their microbiome, they possess bacteria that when they metabolize lecithin and carnitine, the end product is TMA, trimethylamine, which is rapidly oxidized in your liver to trimethylamine oxide. Now, the interesting thing is that trimethylamine oxide will injure your blood vessels. But when Stanley Hazen took somebody who was totally plant-based, fed them a lamb chop, measured their blood for TMAO, zero, none. Why? Because persons who are totally plant-based do not possess the bacteria in their gut, in their microbiome, that has the capacity to convert lecithin and carnitine to TMA.
Yeah. Yeah.
So that, and yet paleo and keto loaded with meat and fat, and of course loaded with TMAO.
Yeah, in fact, it's true. Although, and I must say, I'm always like, when we talk about paleo, I'm like, well, I'm quite sure that paleo, in the Paleolithic area, people didn't really have access to meat every like meal. So even then, I think they're doing it wrong, because it would probably be mostly plant-based, you know. So that's an interesting angle to look at, perhaps. They're doing it wrong. Yep.
Well, if you were a pristine island in the Pacific hundreds of years ago, eating vegetables and fruit, which is a very healthy diet, there was no problem. But I can recall one of those islands, Micronesia, Nauru. They were doing beautifully until suddenly somebody discovered that they had the richest deposit of phosphate from all these birds for thousands and thousands of years. So suddenly in comes the cargo ships, in comes the backhoes, the steam shovels, and they start excavating this phosphate. And everybody seemed to suddenly become a millionaire. And millionaires in Micronesia are going to eat like they do in the West. They'll have meat 5 times a day. And suddenly, rocketing up went sky high, went to heart attacks and diabetes, took over the island.
Yeah. No, that is proof right there. You don't even have to control. It's a controlled study without doing it on purpose. Changing a whole culture, a whole, a whole tribe basically, and giving them heart disease. Yeah, we haven't been very good with that. Going to places and bringing our bad habits. I must say, it's a little sad to see. I grew up. Well, I'm half South African, so I spent some time in SA, and I visited some rural areas where people are still eating very wild diets. And although they have some ceremonies where they have animal products, the majority of their food is coming from roots and fruit and everything that they can forage. So you can see that they just don't have the kind of diseases that we do. And then you see the people that have been moved closer to cities, and they've incorporated a much more meat heavy or animal heavy diets, and they all are overweight, and sick. And there's a lot of not just transmittable diseases from viruses, and that probably is also due to the fact that our immune systems are suffering because they don't get enough good nutrition, but also we see diabetes and cardiovascular disease being huge in this population. So, and that was never the case before. So I think those are something to really be looked at. I noticed, and this probably was what fascinates me about how we look at nutrition, and how we look at the world. To me, preservation of our health is really an extension of how we preserve our planet. Looking after our planet in a kind way, learning how to work with nature. I truly believe the Most High is giving us everything we need in our plants. It's medicine, truly medicine. So that is always something that I love. Last words before we close. I know you're busy, and we're coming up to an hour, so I don't want to take too much of your time. But if you had to give an inspirational, let's give someone an inspirational day of eating in the life of Dr. Esselstyn. How do you start your day? What do you eat through the day? So let's get people to do the same.
Well, we have a wonderful breakfast. I usually like to have old-fashioned Quaker oats with a few raisins and a banana, and then I like to have some flaxseed meal, plus raspberries, blueberries, strawberries, and blackberries. And that's a good breakfast. And then lunch, we always have, some days it might be a sandwich that would have cucumber, or it may have sprouts, and it may have a little bit of hummus, and it'll be in whole wheat bread, probably Ezekiel, which does not have any oil. Mm-hmm. Supper time, it may be, well, last night it was actually a beef, beet burger, beets, a beet burger with a whole wheat bun, and again with some sprouts and some arugula on it, and again some hummus. Sometimes for lunch we'll have a soup, or it will be a sandwich. And then there's a wonderful variety of all these evening things, where a stir fry of some grain, over which we'll have a bunch of wonderful vegetables. And you can do that with any grain, which makes it kind of exciting. But I think my parting words to your audience would be that I guess I'm terribly optimistic about the future, because I see that we could really make a seismic revolution in health. And the seismic revolution in health is never going to come about with the invention of another pill or another drug, another stent, another bypass. But the seismic revolution will come about when we in the profession have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them as the locus of control to absolutely annihilate chronic illness. Yeah.
Yeah, you're right. I love this positive ending, because we need it. Dr. Esselstyn, thank you so much for taking the time. I will share all of your details on the show notes so people can get in touch and look at your program and buy your book, which is actually amazing. And I'm really grateful that you do the work that you do, and that you were so kind and graceful to share with everybody. Thank you so much.
Thank you, Chantel. All the best. Bye-bye.
You too. Bye.
Thank you, Dr. Esselstyn, and thank you everyone for listening to the episode. I hope this really brought you enough information for you to start looking at your health, making sure that you are healthy, not just feeling well right now, but actually healthy long term. If you want to know more about Dr. Esselstyn's program, we have all the information in the show notes, so feel free to look it up. And as always, if you like this episode, please like it, share it, rate it, and I will see you next week for episode 4.